Hi, I'm Kathleen Roquillo, your student nurse from Section 11K. And for this video, I am going to do a written demonstration on how to assess the thorax and lungs posteriorly and anteriorly. So without further ado, let's get started. Okay, so for the pre-introductory phase, first is review client's previous medical records if available, so that we can have a better grasp of the patient's health. It enables us to see patterns and make more effective decisions on the patient's health needs. The second one is we have to determine the scope of assessment needed, prepare necessary equipment. So the following equipments are stethoscope, used for auscultation. We also have alcohol, used for hand hygiene. And then we have the marker. It is used for marking, and ruler for measurements, and we have the comprehensive assessment for the documentations of the patient's information. And lastly, before we begin the assessment, we have to do medical hand washing first. Hello sir, good morning, how are you?
I'm fine.
Okay, so before anything else, I would like to introduce myself. I'm Kathleen Roquillo, your student nurse for today. And I would like to verify some of your information. So what is your name?
My name is Christian Paul Ronquillo.
Okay, so what do you want me to call you, sir?
You can call me Paul.
Okay, Sir Paul. So how old are you?
I am 18 years old.
Okay. Okay, so where do you live, sir?
I live in Barbus, Regado del Sur.
Alright, sir. Okay, so when is your birthday, sir?
June 4, 2003.
Alright, sir. So what's your religion?
I am a Roman Catholic.
Alright, sir. Okay, so for today, sir, I'm going to assess you prior to your thorax and lungs posteriorly and anteriorly. And I need to ask you to stood, to sit, and take off your t-shirt. And the purpose of this, sir, is to examine if there are any abnormalities that can be detected by inspecting your thorax and lungs while breathing by palpating, percusing, and auscultating your thorax and lungs, sir. Alright, so for now, sir, do you have any questions, clarifications, or any concerns?
And so far.
Alright, sir. I assure you, sir, that all of your information will be kept private and your response will be documented so that we will be able to provide you the best possible treatment. Okay, so for now, sir, I'm going to do hand hygiene first.
Okay.
Okay, so the purpose of this is to eliminate microorganisms and for the safety of both me and the patient. Okay, so for now, sir, I already provided you of the privacy by closing doors and windows. And I assured you, sir, that we are far away from any distractions that may hinder our assessment. Okay, sir?
Okay.
So for now, sir, I am going to ask some questions with regards to your current health. Okay, so for now, sir, do you have a cough?
Yes.
Alright. Okay, so how long have you had that cough, sir?
It's been 3 days already.
Alright, sir. Okay, so when you cough, sir, do you bring up anything?
There's a phlegm and it's yellowish.
Okay. Okay, so do you have any associated symptoms with the cough, such as fever, chills, or night sweats?
I guess colds only.
Alright, sir. So what have you used to treat the cough, sir? Has it been effective?
For the cough, I take Robitussin, and for the cold, there is no medication for that.
Alright, sir. So do you have difficulty breathing, sir?
None.
Alright, sir. So for now, sir, are you comfortable?
Yes.
Okay, so can you take off your t-shirt, sir?
May I take off the mask?
Yes, sir.
Okay.
Okay, alright, sir. You may sit down, sir.
Okay, thank you.
Okay, so first is we're going to do surveying the chest and respiration. So we have to check for signs and respiratory distress like the nasal flaring, pursed lip breathing and retractions, or problems with oxygenation, and observe color of face, lips, chest, and fingernails. Okay, so for next is we're going to palpate suprasternal notch. and noted the position of the trachea. Okay, so the rationale for this is to see if the patient is having to work harder to breathe or are not getting enough oxygen, which indicating respiratory distress, right? Okay, so for now, sir, can you inhale and exhale for me, sir?
Okay.
Inhale, exhale, inhale, exhale. All right, sir. Okay, let me check the color of your face, your lips, your chest. All right, sir. So you can, may I see your fingernails, sir? All right, sir. All right. So can you look at your right side, sir? All right. So your left side. All right, sir. Okay. So next is we're going to examine the posterior thorax and lungs. So first is I'm going to inspect the configuration. So while the client stands with arms at the sides, we have to stood behind the client and observe the position of scapulae and the shape of configuration of the chest wall. So the rationale for this is refers to overall structure of the chest, like the shape and anteroposterior diameter versus the chest first diameter. Alright, sir. So for now, sir, can you stand up? I'm going to palpate your chest. Alright, sir, can you face backward? Okay. Alright, sir. Okay, you may sit down, sir. Okay, next is I'm going to inspect the spinal alignment for deformities. So first, from the lateral position, we have to observe the three normal curvatures, the cervical, the thoracic, and the lumbar. And then, for now, is I'm going to touch your neck, sir. So can you please stand up again, sir? Right. Alright, sir. Okay, the next is we have to assess for lateral deviation of spine or scoliosis. Observe the standing client from the rear. Have the client bend forward at the waist and observe from behind. This is to determine any abnormal curvatures of the spine. Okay, sir, can you tie, like tying up like shoelace? Can you bend? Alright, sir. Alright, sir. Okay, can you sit down, sir? Okay, next is I'm going to palpate the posterior thorax. First is I need to assess the temperature and integrity of all chest skin. And then we have to palpate it all the thorax areas for bulges, tenderness, or abnormal movements, especially for clients who have respiratory complaints. The rationale for this is to detect any abnormalities by merely inspecting the thorax as the patient is breathing. Okay, sir, can you face backward, sir?
Okay.
Okay, I'm going to palpate your posterior wall. Alright. Okay, next is I'm going to palpate the posterior thorax for respiratory excursion or thoracic expansion. First is you need to place the palms of both your hands and over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. And then we have to ask the client to take a deep breath while you observe the movement of your hands and any loud movement. Okay, the rationale for this is the movement of the thoracic diaphragm during breathing. Okay, sir. Next is I am going to make the patient inhale and exhale. Sir, can you inhale and exhale for me, sir? Inhale. Exhale. Okay. So for now is alright. Okay, inhale, sir. Exhale. Inhale. Exhale. Inhale. Exhale. Alright. Okay, next is I'm going to palpate the thorax for vocal tactile firmitus, that faintly perceptible vibration felt through the chest wall. Then the client speaks. First is place the palm of surfaces of your fingertips or the ulnar aspect of the hand or closed fist on the posterior thorax, starting near the apex of the lungs. And then I have to ask the client to repeat such words such as blue moon or 1, 2, 3, and repeat the 2 steps sequentially down to the base of the lungs and compare as suggested. This is to assess the increase or decrease of lung density. Okay, sir? I need you to say blue moon repeatedly.
Okay. Blue moon, 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 blue moon.
Alright, sir. Okay, next is I am going to percuss the posterior thorax. So first is I'm going to ask the client to bend the head and fold the arms forward across the chest. And then we have to percuss in the intercostal spaces at about 5 centimeter intervals in the systematic sequence and compared one side of the lung with the other and percuss the lateral thorax every few inches. We have to start at the axilla working down to the 8th rib. So the rationale for this is to assess for the lungs resonance. Yes, I'm going to percuss this here. Alright. Okay, next is I'm going to measure the diaphragmatic excursion. First is use percussion to identify the level of the diaphragm and measure diaphragmatic excursion. We have to percuss downwards from the above expected level of diaphragmatic dullness until dullness is definitely heard, and mark the level of full expiration. And have the patient inhale deeply and hold it in. Then percuss downward to the level of dullness and full inspiration and mark it. And repeat the process on the other side. You have to measure the distance between their expiratory and inspiratory level of dullness. This is to assess the patient's airway, since diaphragmatic excursion is sensitive to change in respiratory patterns. Right, sir? So can you inhale for me, sir, and then hold it? Alright. Okay, so inhale for me, sir. And exhale, sir. Alright, inhale again, sir. Exhale. Alright, sir. Other side, inhale for me, sir. Exhale. Inhale again, sir. Exhale. Alright, sir. Okay, next is I am going to auscultate for breath sounds. First is we have to place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung at C7. And then we also have to ask the client to breathe deeply through the mouth for each area of auscultation and use systematic ladder pattern used in percussion. We have to listen for the breath sounds during a complete inspiration and expiration. And we have to find at each point with the corresponding point on the opposite side of the thorax. So this is to note the location of the chest wall where adventitious sounds are heard, as well as the location of such sounds within the respiratory cycle. So this is to assess airflow through the airways. Right, sir, so I'm going to auscultate you, sir. Okay, can you inhale, sir? Exhale. Inhale. 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 Exhale. Inhale, sir. Exhale. Inhale. Exhale. Alright, sir. Okay. Next is auscultated voice sounds. So first is we have the bronchophony. This is to ask the client to repeat the phrase 99 while auscultating the chest wall. The second is we have the egophony, which is ask the client to repeat the letter E while listening over the chest wall. And then whispered pictoriloquy, ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. So this is to hear sounds about what's occurring inside the body and can provide important clues about the respiratory abnormalities. Right? So first, sir, is say the number 99 while auscultating your posterior wall.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, sir. Next is I'm going say the word next is say the word E repeatedly.
E, 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 E.
Okay. And lastly, sir, whisper the numbers 1, 2, 3.
Okay.
All right, sir. Okay. So next is we're going to assess the anterior thorax. So first is inspected breathing patterns and inspected the costal angle formed by the intersection of the costal margins. So this is the angle which the ribs enter the spine. So the rationale for this is to evaluate the expansion of thoracic cage. Okay, so for now, okay, sir, can you face forward?
Okay.
And then can you inhale? My apologies for the unexpected scenario because the plastic chair cannot withstand the patient's weight. However, I assure you that the patient is okay. So hoping for your kind consideration. Thank you, and let's continue. Okay, so for now is we have the anterior thorax. So the procedure for this is first we need to inspect the breathing patterns, and the second is we have to inspect the costal angle or the angle formed by the intersection of the costal margins and the angle at which the ribs enter the spine. So the rationale for this is to evaluate the expansion of the thoracic cage. So for now, sir, can you inhale and exhale for me? Exhale, inhale, exhale. So may I touch your abdominal part, sir? Alright, sir. Okay, next is I am going to palpate the anterior thorax. So first is using your fingers to palpate for tenderness and sensation. We have to start palpate the hand position over the left clavicle and move forward from the left to right, comparing findings bilaterally. And we have to move hands systematically and accordingly as suggested, then repeat for crepitus and fremitus. For the rationale for this is to see any abnormalities that can be detected by merely inspecting the anterior thorax as the patient is breathing. Okay, so for now, sir, I'm going to palpate your chest. Alright. Okay, next is I am going to palpate the anterior thorax for respiratory excursion. So first is you have to place the palms of both hands on the lower thorax with your fingers laterally along the lower rib cage, along the costal margins. And we have to ask the client to take a deep breath while you observe the movement of your hands. And the rationale for this is respiratory excursion is the movement of the thoracic diaphragm during breathing. Okay, so for now, sir, I'm going to palpate. Okay. Can you please inhale, sir? Exhale. Inhale. Exhale. Inhale. Exhale. Alright, sir. Okay, next is I am going to percuss the anterior thorax systematically. So first is begin percussing above the clavicles in the supraclavicular space and proceed to downward to the diaphragm and compare the lung on to the side of the lung onto the other side. And displace female breaths to facilitate percussion of the lung. This is to assess the lung's resonance. Okay, sir, so can you lay down on the bed, sir?
Okay.
Sir, and then I am going to percuss. Okay. Alright, sir. Okay, can you please sit down, sir? Okay, next is I am going to auscultate for anterior breath sounds, adventitious breath sounds, and the voice sounds. So I have to auscultate the trachea and auscultate the anterior thorax. So first is we have to place the diaphragm of the stethoscope firmly and directly on the anterior chest wall, and then we have to ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with the nasal breathing. And then we have to use the systematic zigzag procedure. Listen to each point of the breath sounds during auscultation. For the rationale is to assess airflow through the airway. Okay, sir, I'm going to auscultate you, sir. And then can you inhale and exhale for me? Okay, can you move sideways, sir? Sir, sir. Inhale, sir. Exhale. Inhale. 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 Exhale. Alright. Okay, so for the overall assessment, sir. Okay, let me record first, sir. Alright, sir. So from your overall assessment, sir, I am just going to sum up everything that we've covered. So first is I noticed that your lips and nails are pinkish and it is normal, and your scapulae are symmetric and at equal horizontal positions, as well as your shoulders. Your spine is also vertically aligned. While palpating your posterior and anterior thorax, your skin is intact and the temperature is warm to touch. And then you have no tenderness or masses. And during your palpation of your respiratory excursion, I noticed that you have unequal chest expansion. And I noticed that while you're counting 1, 2, 3, there is an increase in your fremitus. And while I was listening to your breath sounds, it has a coarse crackle with a loud low pitch and longer lasting. Your breathing is also labored. So while measuring the diaphragmatic excursion, it is 4 centimeters between full inspiration and full expiration. And then instead of hearing resonance, I heard dullness, short note sound, which is clearly because of your wet cough. Okay, so for now, sir, I encourage you to engage cardio exercise after your full recovery. Drink plenty of water, and then you have to eat fruits that rich in vitamins such as citrus fruits or papaya, and then you have to drink fresh pineapple juice, or you also have to eat healthy foods. And then you have to avoid foods that can trigger your cough, such as peanuts or chocolates or cold foods. So for now, sir, that's all the assessment. So do you have any questions or clarifications or any concerns?
None.
Alright, sir. So if you have any questions or further questions, you can ask the attending physician that I'm referring to. Alright, sir. So for now, that's all. Have a good day, sir.
Okay, thank you.
Thank you. Alright.